Depo-Provera is also known as the shot. It's an injection of birth control of the hormone progesterone, and it works by suppressing ovulation, so it makes it so that the body doesn't ovulate, and therefore there's no egg there to get pregnant. It can also thicken the mucus of the cervix so that it's harder for sperm to go into the uterus to create a pregnancy in the first place. The injection you get once every 3 months, and it's important to get it in the window so that you are continuously covered during the time that you're using this form of birth control. If you get it on time, as you're supposed to, it's very, very effective, over 99% effective. What they call typical use, which is some people get it on time, some people don't. Overall, they find that it's 94% effective for people. Depo definitely can change your menstrual cycle and the kind of bleeding that you have. Some people don't get periods at all on Depo. Some people get irregular bleeding. Sometimes people will have a little bit of bleeding once every 3 months when it's getting close to time for their shot to be due, but it's hard to predict what that will be for any one person. Occasionally, some people will have heavy irregular bleeding, and again, it's just hard to predict what will happen, but you can always be working with your healthcare provider to see how that's going for you and what can be done to manage it in a way that works for you. Some possible side effects of Depo, one of them is changes in your mood. So some people who, especially people who have pre-existing concerns with depression or changes with mood, Depo can make that worse. So that's something to consider if that affects you. And just something to be on the lookout for if that's something new to you, but something that has come up since you started Depo, to talk to your healthcare provider about. Another concern that people have a lot of times with Depo is weight gain. There haven't been any studies showing that Depo necessarily causes a lot of weight gain for people, but some people have had that experience. Some people suggest that it can increase your appetite and not necessarily make you gain weight, but can cause weight gain indirectly. But again, that's different for every person. Many people don't gain weight on Depo. One of the concerns with Depo is that it has been observed that it can decrease people's bone density. We don't know that there are any long-term consequences of this. It tends to be that once you get off Depo, your bone density goes back to normal. And again, we haven't found that it causes people to have more fractures or have any other serious consequences, but because of the possibility, we do recommend that while you're using Depo, you make sure that you get enough calcium, whether that be through your diet or through taking additional calcium supplements. So one thing to know about Depo is that it can take longer once you stop using Depo to get pregnant. Most forms of birth control you can get pregnant right away, and it is possible that you would get pregnant right away with Depo, but for a lot of people it can take longer, up to 6 months or a year before it's completely out of your system and affecting you in that way.